The following program is a production of WXCL Television.
Good evening and welcome to a special edition of South Florida Today. I'm Tony May. Tonight in our Health Matters special, we will be discussing the health reform plan that looks to be near reality in Congress. The House passed their version last week. Now Senate is set to debate its version. What will this mean to residents in Palm Beach County and the Treasure Coast? That's why we're here this evening. Last week, we introduced you to a few programs that are providing health care to those who are underinsured or uninsured. But soon there will be programs all over the country dictated by the health reform plan. What will that mean to those who are uninsured and those who are insured? Well, joining me this evening are several guests. Hopefully they'll be able to answer some of the questions. Joining me is Dr. Earl Fox, the director of the Florida Public Health Institute, Dr. Alina Alonso, the Palm Beach County Health Department director, and Paul Gianfrido, president of Quantum Foundation. Welcome to you all. Well, first of all, we know that Senate is, I'm sure, just about to debate or soon to debate their version of the plan. House passed its version of the plan. Dr. Fox, you've spent many years in D.C. You were part of the Obama transition team. What's your feeling about what will come out of the Senate? Will it be really different than what we saw the House pass?
I don't think it'll be tremendously different. It's probably not going to be a bill that any of us are going to be really, really happy with. But at this point, I think any bill that would expand health coverage for most Americans would be a good bill. So I think it's going to be fairly close to what the House is considered. And
Dr. Alonso, there is a provision, I know, in both versions of the bill for local public health departments, both programs and infrastructure. How tied into what's going on in Congress is the health department?
Well, certainly at the level of Tallahassee, they're much closer. We're busy here doing the local work that needs to be done. But what we do know is that no matter what passes, we will probably have more responsibility and have to take care of more people. So it's about surge, it's about capacity, it's about being able to provide those services for those individuals.
And is the state kind of monitoring it to the point that they give you daily updates? This is, what the House plan, if it passes the Senate intact, would be to you, the director of the largest, public health department in the state?
Yes, we have weekly updates in terms of what's going on.
And Paul, the Quantum Foundation is at mainly healthcare foundation focusing on providing access. I know that access is a big worry for some of the people who are saying, okay, now we're going to insure 46 million uninsured in America, but where will they get health care? Is that a problem here locally as well?
Well, that is a big problem. Health reform really has two pieces. One is healthcare coverage, and the other is making certain that there are adequate supply of providers, particularly on the primary healthcare side, to take and absorb all of that demand. Right now, the problem that we have is that there are a lot of people who don't have coverage, but the other side of the problem is there's also restricted access or limited access because we don't really have all the providers we'd like to have.
And Dr. Fox, I know that you've really been watching this closely. As far as the access question, do the two different bills or the ones that you've seen have access reform? Are they providing access, or is it mainly just focusing on getting everyone insured?
Well, I think it's both, but the fact that we can have a larger number insured is going to provide more access. I think Paul is correct in that even in Massachusetts, it's past universal reform. We know the number of people going to the emergency rooms did not go down. And the reason I think most people believe that's the case is because there are not enough primary care providers for people to be able to get an appointment to get in to be seen. So I think we're going to have an issue there. with the workforce. But I do believe it'll be a good thing, and just the fact that people have coverage, we know, makes them much more likely to get preventive care, much more likely to get into care, and much more likely to have better outcomes.
Now, the bill's over 1,000 pages long, and most Americans don't have time to read the old-fashioned newspaper, let alone a bill. What are some of the things, as somebody who's been in public health for most of your career, what are some of the things that Americans and residents here locally should applaud, should be happy about, that you feel confident will come out of the final form?
Well, I think the first thing for elderly and people over 65, which we have a lot of in Palm Beach County, is hopefully they're going to close the donut hole for prescription drugs. That's a huge problem for people right now. There's a period of time where people are 100% liable for cost of prescription drugs that are on Medicare with Part D. I think that'll change, and that donut hole will go away. We're hopefully going to have more money for public health and prevention. I think that'll be a very good thing. We're probably going to see an expansion of Medicaid and some of the other programs, which I think will be a good thing. We also are going to see, I believe, in either bill, whether it's House or Senate bill, the elimination of a lifetime cap. I mean, now with somebody with health care costs today, one severe illness could bring any of us over our lifetime cap. And the other thing we'll see is probably elimination of being able to exclude people because of pre-existing conditions. And that's also a good thing, because the older we get, the more likely we're to have a pre-existing condition. I think those are all very good things that are probably going to come out of whatever bill passes.
And Dr. Alonso, whatever bill passes, there are going to be a lot more people with insurance, obviously. What will that do as far as the stress on the clinics that the health department runs currently?
Well, one of the issues that we haven't mentioned is that just because a person is eligible for Medicaid or any plan that's out there doesn't mean that the person gets it. So I think one of the things that we have to do is to make that eligibility or that process of getting insurance easier, so that a common person like you and I could fill out the application and get on. For that end, we're working towards that already in the health department by having navigators within our system that actually help people get onto the type of insurance that they qualify for.
And I know you're on the board of the healthcare district. How would the insurance plan that would be mandated by the federal government affect, like, the local healthcare taxing district insurance programs? Would they be duplication and then they would change them, or would they mirror them?
Well, the healthcare district would not pay for anything that is available federally. So if the Medicaid expands, you will see then less people have to go onto the healthcare district plans. And that would give the healthcare district an opportunity to re-examine the plans that it does offer and be able to shift some of those dollars into other things like prevention, which is where I'm hoping that we will go in the end of all this.
Well, I know in at least the review I read, that there is a prevention component, and a strong one in the House plan that was just passed. Paul, I know last week we looked at one of the federally qualified health centers that Quantum helped fund. With the plan and certainly with the focus here on Palm Beach County, would this make it easier to expand FQHCs in our area?
Well, I would hope so. Again, more Medicaid funding, more dollars from the federal government is all a good thing from the perspective of the county taxpayer. And Lena's right. The opportunity I think that we have here for the healthcare district to be able to move into new territory, to be able to do more with prevention, maybe to do a little bit more with the improvement of access to care, looking for the providers. These are only good opportunities that will come from this healthcare reform if it passes close to either the Senate or the House version at this point, particularly with regard to the Medicaid expansion.